Welcome everybody to the 2021 Salisbury Foundation Trust AGM. When we gathered together for the similar event last year, I think we're all hopeful that that will be the only time we needed to do this remotely and virtually. However, events have overtaken us, and yet again we are doing it through Zoom. But hopefully we can still give you the messages that how the organisation has performed over the last 12 months, and also some of the highlights and possibly challenges that we've faced in that time. We have a number of speakers and we have an agenda that will cover many of the things that have happened over the last 18 months of COVID pandemic, but also what we're trying to do to help recover and make the hospital available to patients on a much wider basis than perhaps we've seen over these last 18 months.
Hi, my name's Stacey, the Chief Executive of Salisbury Foundation Trust Hospital. I'm delighted to be able to speak with you today as part of our annual general meeting, where we'll pause and take an opportunity to look back on the activities during 2020 and this early part of 2021. And what a year it's been. I don't think any of us could have predicted the year that we've all had. I didn't expect necessarily to be talking to you today about COVID and the pandemic response still, but very unfortunately that's been a feature for our staff and dominated some of our landscape, as I'm sure it has for you and your families at home. Thank you is a really simple word and never seems enough. And I want to offer as many thank yous as I possibly can today, and my really great appreciation to people who have stepped up and delivered against what I know have seemed like relentless pressures over this last 12 months. So that first and foremost, that's to my colleagues here at Salisbury Foundation Trust. I also want to take just another opportunity to thank our military colleagues who came and helped us during that period of time, our partners, so our adult and children's service colleagues from the local council, our local GPs, our mental health partners, our community partners, and many voluntary groups, all of whom worked tirelessly to help us deal with the brunt of that pressure. I want to thank the general public because I know for some of you, you have got long waiting times that wouldn't have been the case prior to the pandemic, and people are having to be patient with us. My colleagues are putting in huge efforts and catching up on some of the work that they hadn't been able to do in really good time. I said to you earlier in the year that I thought it would take us at least 1 to 2 years to get back to the sort of waiting times that we had pre the pandemic, and I'm pleased to be able to report that we are making really good progress with that. We've been able to start all of what we would describe as our planned services, so things like operations, tests, people who are coming in for day case procedures. We've got more to do, so say we're making good progress, but we've got to continue with those priorities. But things like our cancer care, things like all of our diagnostic services and all of our elective surgeries are all back up and being offered to our communities. And I'm really pleased that our teams have been able to respond in that way. I think the really positive things around COVID, and it is really important for me to mention those, is we've learnt a huge amount. That's thanks to our amazing scientists and researchers, and our research team here at Salisbury Hospital made a really significant contribution to COVID-specific research, and that is research that's had a worldwide impact on how we've all been able to live our lives over this last 18 months. So my absolute thanks to our research team. I want to pay testament to our colleagues who have been busy giving out more laptops than ever, shoring us up in things like cyber security, and working really hard in the background over this last year to make sure that we're advancing our digital plans, which are a really important part of our infrastructure and how we deliver care today, but how we will want to deliver care in the future. In terms of our clinical divisions, there is so much to be proud of. I couldn't possibly list it all with you today, but just to pull out a few highlights, our colleagues in children's services continue to do a brilliant job. We know that children and young people have been impacted by the pandemic, not necessarily being able to go to school and socialising in the way that they normally would. And we are seeing some increases in demand for our services on the back of that, and our children's services and paediatric teams have been doing a fantastic job in responding. I think for our maternity services, their service hasn't changed that much in the pandemic, interestingly, so we've continued to deliver over 2,000 babies in the last year. Our midwives and our obstetricians, we know, give a really great service. You tell us that. Women who use our service really value the experiences that they get here. So my thanks and appreciation to them too. Whenever I start to talk about services, I know that there is a long list, all of whom I want to pay credit to. But in the interest of time, I just wanted to be able to pull out a few highlights for you today. And thank you to the people who take time to write to me. I'm in a very privileged position, and I get letters very regularly and emails really expressing to me the dedication and lengths that our people go to make sure that you get great care and that you are looked after in a way that I would really hope and want you to be able to be looked after. I also want to mention our accident emergency team. So they often are at the brunt of our day-to-day pressures from urgent and emergency care, and it's been particularly busy over this last few months, not just responding to the pandemic, but supporting people who are needing to access care each day. Some of those people who haven't accessed care during the pandemic. And I did want to really pay attention to the work of our procurement team. So these are people we rely on to get us all of our equipment that we need to be able to deliver those services each day. And during the pandemic, they have had to really step up because we have needed extra equipment and things like our face masks and gloves and all of the protective things that have kept our staff and our public safe. As well as the care that we deliver to you on a day-to-day basis, many of my colleagues have been busy in the background working with our partners on something called our integrated care system, and this is a significant change in the way that we hope to deliver care in the future, working collaboratively with partners to make sure that care feels joined up from yours and your family's perspective, and we take advantage of all of the talents of people across community, social care, GPs, in a way that perhaps we've not done as well as we could have before. So there'll be more of that to come in future years, but Salisbury are making a really significant contribution into those partnerships. I think the future over this next 1 to 2 years is going to be some more of what we've talked about today. So we will continue to need to be alert to the pandemic. We are busy making preparations for our flu vaccination programme, for what will be the booster programme for COVID. We're doing some winter planning at the moment because we know that we often get busier still in the winter months. So thank you for listening. I hope it's helpful to get a bit of an update and insight into some of what's been happening in your local hospital over this last 12 months, and I look forward to meeting some of you at our meeting later in September.
My name is Duncan Murray. I'm the Clinical Director of the Surgery Division at Salisbury Hospital, and I'd like to talk briefly about some interesting and innovative work we've been doing managing long waiting times for paediatric surgery in our integrated care system. Some work that we've been doing for several months now with our system partners in Bath and Swindon together with Salisbury. Many people will know that with the pandemic there was very significant disruption to elective care and surgical care included in that. And on top of previously existing waiting times, the pandemic resulted in particularly long waiting times for children for oral surgery and ENT surgery in the BSW region. We had about 800 patients waiting for surgery in these specialties, many of whom had been waiting over a year for treatment. So it was a sizable problem and an important one for us to try and address as rapidly as possible and at some scale. So on the back of that, a group of paediatricians, surgeons, anaesthetists, operational managers and commissioning partners got together for a series of meetings, weekly meetings online through the winter and spring of this year, and through really impressive and significant collaboration at every level, we've been able to treat about 140 patients or so on this waiting list. over a series of weekends run out of the day surgery unit at Salisbury Hospital. To briefly give you a sense of what that looked like, on one of these weekends, for instance, we would have had, if we talk about one particular patient, for instance, a patient coming from Bath, or the Bath area, coming down to be operated on in our Salisbury day surgery unit by a surgeon from Swindon, being looked after by an anaesthetist from Salisbury, being cared for both in theatre on the wards by staff from Salisbury, Bath and Swindon, using surgical equipment from Salisbury and Swindon, and all of those plans would have been put in place by operational managers working in collaboration between Bath, Swindon and Salisbury and the BSW CCG. So that just gives you a flavour of the extent to which people have been willing and able to work together and establish new clinical and operational relationships, which we hope will stand us in good stead for the future, both for this population of patients, but we envisage similar principles being able to be applied to other forms of treatment and other areas of clinical practice. So just a neat example of how integrated working at provider level has been very effective in addressing a problem that's arisen out of some of the challenges thrown up by the pandemic.
Hi, my name is Lisa Thomas and I'm the Chief Financial Officer at Salisbury Foundation Trust. Welcome to the annual look at the financial position of Salisbury. As colleagues might be aware, the accounts are made up of a group of organisations: Salisbury NHS Foundation Trust, the charity, also known as the Stars Appeal, subsidiary businesses, namely Salisbury Trading Limited and Oddstock Medical. These accounts have been audited independently by Grant Thornton. They gave their opinion that the accounts were not materially misstated and they were duly submitted to NHS Improvement and presented to Parliament within the appropriate timescales. COVID impacted the Trust in every way. Firstly, the way that money flows to the Trust historically is based on the number of patients we treat, the complexity of treatment and how long patients stay. We would normally have a contract with the CCG based on the patient mix. However, nationally these rules were suspended. Instead, the Trust was paid on a block basis, essentially a fixed sum of money with a top-up funding to cover the impact of COVID. All trusts nationally were expected to break even following the receipt of the national funding. This obviously meant an improved financial position of 78k surplus, which compared to more recent years is an improvement, albeit for unfortunate reasons. In essence, the Trust received £32 million more income in 2020-2021 to cover the impact of COVID. This funding covered the direct costs of COVID, for example, additional staff, testing and personal protective equipment, the indirect costs of COVID, the inability to achieve savings through service transformation or the duplication of patient pathways due to infection control measures, lost income, e.g. we saw less patients and visitors on site and received less money through catering, and the deficit that we had pre-COVID, which was just between 10 and 15 million. Outlining a bit more about the COVID costs, COVID impacted the Trust financially in many ways. The obvious areas were where costs increased associated with testing and the need for additional cleaning and personal protective equipment, PPE. The increased pay costs reflect, as the rates of COVID rose in the community, this impacted on the number of our clinical staff available to work. Sickness and isolation levels increased, costing more to ensure clinical areas were staffed safely. Costs associated covering additional sickness in new areas directly was about 5.7 million. 62% of this cost related directly to hours worked by the Trust's existing employees working overtime and bank shifts. As you can imagine, demand for interim agency staff nationally meant securing additional external people to work here was very difficult. Particular areas of additional costs to note include the pathology team, who've worked tirelessly to manage the increase in both staff and patient testing. They saw significant increase in demand, necessitating investment in equipment and staff time. Some of the indirect costs were the need to separate pathways of care, ensuring COVID positive and patients with other conditions were separated. This has a cost in terms of duplication of services, needing additional staffing running 2 areas, for example, in the emergency department. The final point to highlight were 2 technical adjustments. The pay position included £8 million to reflect the Department of Health's pension statement. We received income to cover this cost, And secondly, the Trust had to account for just under £1 million associated with more of the workforce not being able to take all of their annual leave by March 2022 for obvious reasons. The Trust had to also spend more capital money on responding to COVID, spending an additional £5.3 million. This included the expansion of critical care, outpatients and moving services within the Trust to create a greater ED footprint. The funding was allocated to us from a national fund. The Trust was also in receipt of critical infrastructure funding to address the underlying mechanical and electrical engineering issues. The Trust prioritised air handling unit replacement. We continue to spend on modernising digital, including funding for pathology, laboratory management system and electronic prescribing systems. The Trust also opened the first of 2 new replacement MRI scanners. Whilst we achieved an awful lot despite COVID, the challenges of securing funding to address some of the building infrastructure problems on the south of the site remain live. We continue to plan to replace our day case unit and ensure we can respond to any national funding that might be available. Good quality buildings are essential to ensure we deliver outstanding and efficient care to our population. This year on the whole, I could argue has been financially successful, although it feels disingenuous to congratulate ourselves given the circumstances of the COVID pandemic. Our financial challenges have not gone away. We remain in enforcement action by our regulators, NHS Improvement, due to our underlying deficit. We're also working in a very different financial environment with post-COVID recovery. The regime for the rest of this financial year, 21-22, still isn't completely clear. What I can say is that the challenge to ensure that we see and treat as many patients in a timely way continue to dominate discussions. We're aware of the pending financial challenges as we learn to live with COVID and change the ways in which we work. What is important is that we ensure every pound we spend at SFT delivers value for our local population. Therefore, we will be focusing on working with our care and healthcare partners in delivering services in a more joined up way.
The climbing wall here at Wessex Rehab was originally conceived as a way to make better use of a corridor, and we were very lucky that the Stars Appeal could see our vision and were happy to support us. So they actually funded almost all of the cost of the project. And we had some help from some local climbers at Bouldershack who came and offered us their expertise, but also some practical help to get us off the ground. The wonderful thing about climbing as a rehab therapist is that it requires all of the body. So we're able to work with patients on their grip strength, on reaching and pulling activities, on their balance, and also on general power and strength. And it's just really good fun. It's quite a leveler for patients because not many people have done it before, so you don't have to come with experience to get the best use out of the climbing wall. So it really is a rehab facility that is suitable for every single patient that comes through.
Hello, I'm Lucinda Herklotz and I'm the lead governor of Salisbury Foundation Trust. I've been an elected governor for Salisbury City for 6 years and have lived and worked in Salisbury for nearly 40 years. I have pleasure in introducing the Governor's Report for April 2020 to March 2021. The role of governors is to represent the interests of the Foundation Trust members and the general public. Governors act as the eyes and ears of the membership with regards to the quality of the service that the Trust provides, and holds the non-executive directors to account for the performance of the Board of Directors. The main way they do that is by participating in a number of committees and working groups, and as observers in board-led committees, such as clinical governance, finance and performance, people and culture, and audit. The lead governor also observes the private board meetings. Governors are also responsible for feeding back information about the Trust performance to their constituencies or their organisations who elected or nominated them. We also produce a newsletter twice a year, and in more normal years we can hold constituency meetings where members of the public can attend and hear about parts of the Trust's work and ask questions. We hope that this can resume in 2022. Members can also ask questions of governors at any time by contacting the membership manager, whose details are on the website. April 2020 was the early stages of the pandemic. While inevitably the medical and clinical focus was on responding to the COVID virus and reducing the risk of spreading the disease, The Trust management moved swiftly to suspending non-essential committees and moving other meetings such as the board and the councils and committees online using Microsoft Teams. The monthly meeting between the Trust chairman, Nick Marsden, and the deputy and lead governor moved to weekly to ensure that governors had a regular briefing. We heard about COVID readiness, equipment supplies, bed capacity, the effect on routine work, elective surgery, and most importantly, staff well-being. We were particularly impressed for the willingness of staff to be reallocated new roles in response to COVID and appreciated how exhausting it must have been. And we wish to publicly thank the staff for their tremendous efforts during the year. The lead governor circulated reports of discussions with the board chairman to other governors, and as the year progressed, governors produced their own briefings with the help of the communications team to inform their local communities about the situation in the hospital. Any issues raised by governors were addressed by the board through informal briefings with the chair of governors. A group of governors worked on the proposals for the update of the website and also for improvements on letters to patients. This is all part of improving the communications with members and the general public. The council, during its meetings this year, heard updates on topics such as the campus project, the proposed day surgery unit, the review of the maternity services, and the formation of the integrated care services across Bath, Swindon and Wiltshire. As part of the Acute Trust Alliance, the lead and deputy governors started discussions with their counterparts in Bath and Great Western Trust to share information with and discuss emerging proposals for sharing clinical skills and services. It's early days, but there's a positive approach from all parties. In the new year, the vaccine rollout started, and the hospital not only had to coordinate the staff vaccination centre, but that in the City Hall, and put out a call to ask for volunteers, which had a tremendous response. It is to the management's great credit that these were achieved so smoothly on top of the increase in COVID cases, which was far greater than in the first and second waves. Every effort was made to maintain planned levels of elective surgery, and governors issued briefings asking constituencies to attend the planned appointments unless they'd been told they were cancelled. But inevitably, the increase in COVID cases meant elective work had to be curtailed. The governors would like to thank the staff for their exceptional work during this unusual year and give credit to the executive team and the board in the way in which this year has been managed. We have greatly appreciated the honesty and openness of the executive team and the board in discussing the issues that have been facing them, and we look forward to challenging them and supporting them in the future.
My name's Henry Wilding. I'm Interim Deputy Director of Nursing. So it's a difficult one because I've changed roles within the year itself. My substantive post is Head of Nursing for the Surgical Division. But if I'm talking about the year that was 2020, 2021, it kind of was driven completely by COVID and our response to that. There was really only one story in town. And it really impacted our entire way of working, pretty much as everyone could imagine, but you need to add on another layer because it really took us to places individually and within teams and services that we really thought we'd never get to. How we were required to work completely differently, how we interacted with our colleagues, and more importantly, how we interacted and cared for our patients completely changed. And everyone was really required and had to be really imaginative and creative as to how we approach the challenges and problems. Every aspect of our care, of how we delivered patients, the environment, what we were wearing, how we were going about it, how we supported colleagues and communicated with our patients and teams had to change, and it was completely rewriting the script. But the problem was there is no script for this, and invariably it was a case of working through updated guidance late on a Friday to be implemented the following Monday, and that required a huge team effort, and your normal working hours pretty much kind of went out the window but everyone dug in, and when we survived, we got through it. It impacted us in so many ways. Our normal way of working, our place of work as well. There was a huge amount of redeployments within that, within the year, which still goes on now. Whether that be driven by the clinical experience of the nursing workforce, the allied health professionals, our therapy team, our midwives, our radiographers, pharmacists. So we were all required to chip in and pitch in with the effort. But whether we were moved because of our clinical experience, our own personal risk assessments, health issues, or new pop-up services coming up, it was a constant churn, and everyone from the nursing staff right through to the backroom staff and managing rotas, it was a huge fundamental effort. And this wasn't just coming to work and you turning it on for work. This impacted all of our lives, as we all know, so there is no escape from it. So every aspect of our home lives and work lives was consumed by COVID and our response and requirement to it. But looking back now, there's so many fundamental, really heartwarming stories and good aspects of care, really to be proud of how people underwent it. It's kept to our values and principles and offered some fantastic care for our patients, whether it be liaising with our PALS team, coordinating messages from home, from loved ones, organising virtual visits, our therapy team undertaking their therapy assessments virtually, which we never thought we'd have to do, just getting creative with items of kit that patients would have at home that could be replicated on site as well, and then using Teams link and virtual technology to try and then mirror the therapeutic interventions and techniques that we would normally be doing face to face. Obviously a big shift in the makeup of our wards. We had the respiratory care unit, which was born out of Farley ward, but all of these moves warrant another shift. So Farley ward moving to Laverstock, that's since moved back, but all of these moves are unsettling for teams and patients as well. So, but all carried out, organised to the best of our ability within the time frame we had. We do appreciate a lot of things had to be enacted at speed. So communication at times wasn't as ideal as we would have liked, but unfortunately we were acting at times where we didn't have the luxury of consulting with every aspect. So, but it was very much a positive spirit of what could be achieved. But there was some other stuff that wasn't just COVID, and despite through the front door and everything was all consuming COVID, we're still a 24/7 hospital, and that we've still got the normal deliveries coming through from maternity. We've got the normal traumas, illnesses, cancer diagnosis that are coming through. So despite providing COVID care services, you have to provide the normal running of the hospital. So even those teams that might not have been getting the plaudits and all the media attention like ED and ITU, every ward and every team and service was playing their part because they kept going other aspects of what is our fundamental work. So it was a huge effort for everybody. In the midst of the year as well, obviously we had new arrivals, new recruitments coming through, and a specific mention to our new entrant overseas nurses that have continued to come through. And obviously the challenge for them is, as we've seen in the latter part of the year in question, when other COVID variants are becoming more prominent in their homes, certainly our Indian nurses, and what we saw at the end of this financial year in India, and how that impacted for our overseas nurses as well. So being able to offer them support when they wanted to be back home and their heads were elsewhere. So that was hard for us to come to terms with and how we can support them as well. But everyone really pulled together and we really supported all of our colleagues through that. In the midst of it, we also mixed up the divisions. So we went from 4 clinical divisions or directorates of medicine, surgery, MSK and clinical support and family services. On April the 1st, we started with medicine, surgery and clinical support family services. So essentially we lost the musculoskeletal directorate, which predominantly was absorbed into surgery with a bit going across to medicine. But that can unsettle teams as well. But with the new formation of the divisions and with our executive structure changing as well within the year, with the arrival of Judy and Stacey, obviously both nurses themselves. So we're feeling that connection right through from the ward to the board. So that's been a fundamental shift and change within the year as well. But if I had to sum up the year, was a huge, immense effort, and it is hard now trying to convey in a 2-3 minute video about how hard and how impactful it was for people. People still carry the scars of what they experienced, the impact on their colleagues and for their patients as well. But the way we responded is phenomenal, of how everyone pulled together, and we're still here. We are still dealing with it, and we're still trying to get back to normal, but we're still very much carrying on as we set out with our values and beliefs intact.
So that concludes the formal agenda of the 2021 Salisbury Foundation Trust AGM. Can I take this opportunity to thank my colleagues who gave the presentations, which covered a variety of subjects, including the performance of the organisation from both a patient but also financial perspective, but also covered some of the services and the effect that the pandemic had on those services.